I am Dr. Ravi Shankar. Today I will tell you a few things about endoscopy. So endoscopy is a very common procedure that is done by the gastroenterologist to take a look into the esophagus, stomach and upper part of duodenum. So who are the patients who have to undergo an endoscopy? Patients who have problems of the stomach or duodenum or esophagus are the candidates. What are the usual symptoms? Difficulty in swallowing or heartburn or upper abdominal burning or pain. These are the usual patients who usually get an endoscopy, especially if their symptoms are not controlled within a few weeks. So once an endoscopy is decided by the doctor, the patient will be asked to come on an empty stomach. The patient may be anesthetized. Usually nowadays it is better. The patients are given some sedation and they are monitored throughout the procedure. Monitoring means the cardiopulmonary status will be monitored by generally an anesthetist, and the procedure goes on under monitoring. So what is the procedure? Procedure is inserting a endoscope into the mouth of the patient, which traverses through the esophagus, goes into the stomach, visualizes the stomach, then into the upper part of the duodenum. Basically all this is done to see the mucosa and any lesions that are present in the stomach and esophagus and also the duodenum. So why we should do an endoscopy? Basically we should do an endoscopy to rule out major issues like cancers, and also to diagnose certain smaller conditions like ulcers, gastritis and a few other things. So basically the endoscopies have been diagnose and exclude cancers. So it is a duty of an endoscopist to precisely look into the various parts that have been examined, take a careful look and then rule out or diagnose the conditions. So during endoscopy, the patients will not have any pain, especially if they are anesthetized. Sometimes if the patient prefers to have an unanesthetized endoscopy, they can have some discomfort, but it's not a very big discomfort. So we can say that endoscopy can be done with anesthesia, which may be preferable, especially for some patients. And sometimes if it is done without anesthesia, also it is okay.
Like, comment, and subscribe for more health updates.